Marley Drug.
Hello, welcome to Ask Marley Drug. My name is Deepti, one of the pharmacists here at Marley Drug Pharmacy. Today we are going to talk about statins. Statins lower your cholesterol that your liver is producing and are prescribed to patients with heart disease and to those at high risk. They are the gold standard for high cholesterol treatment. They are a powerful medication class, and they've been proven to save the lives of many men and women with or having high risk of heart attack or stroke. So, if statins are so effective, why is there a lot of negative press? Statins are now one of the most investigated drugs on the market. As with any medication, there are risks associated with taking statins, but the benefits far outweigh the risks for the vast majority of high-risk patients. In this video, I'm going to provide honest and scientific answers to the most common questions. The first question is, how do doctors know that statins are safe and effective? Well, statins have been studied more than nearly any other drug people have taken. It has been studied in more than 170,000 people and for extended periods of time. Statins have been prescribed since the 1990s. Doctors are also aware of the side effects, but any focus on statin side effects needs to be counterbalanced by the fact that statins reduce the people's risk of dying from a heart attack, heart disease, or stroke. Data from the 2008 Jupiter trial suggests a 54% heart attack risk reduction and a 48% stroke risk reduction in people at risk for heart disease who use statins as a preventative medicine. The data is not speculative. Rather, it reflects statins' true potential to save lives and avoid illness. The second question is, do statins cause muscle pain and weakness? Approximately 10% of people who take statins experience muscle aches. It's the most common side effect of statins, but another way to look at it is that 9 out of 10 patients don't experience it at all. Do not stop taking the statin without first talking with your doctor if you are experiencing muscle aches. For almost all patients, your healthcare provider can find an effective medication that your body can tolerate. If you simply can't tolerate statins, there are other cholesterol medications your doctor can prescribe. The side effects are often resolved by adjusting the medication dosage or switching to a different statin. Sometimes, the statins have to be stopped altogether. When a statin is switched or stopped, the symptoms go away and there is no damage to the muscle. Now, can statins increase the risk for memory loss or dementia? Concerns about long-term cognitive problems and memory loss due to the use of statins have not been proven. The most recent data suggests to the potential prevention of dementia due to statin use. Also keep in mind that high cholesterol levels that require treatment and problems with memory are common symptoms of simply aging. Sometimes it's difficult to distinguish these two, so it may seem statin use and memory problems are related at times. Finally, can statins increase blood sugar levels or complicate the existing diabetes? Yes and no. Yes, statins can slightly increase your blood sugar levels. However, the added risk is significantly counterbalanced by the reduction in heart disease risk that a statin can provide. Are you statin intolerant? Or what does that even mean? It means you cannot take statin because of the side effects or adverse effects you have experienced. How common is it anyway? Out of over 4 million patients studied in over 176 trials, 9.1% are statin intolerant worldwide. Who's at risk of having the intolerance anyway? females, patients with hypothyroidism, old age, patients with obesity, diabetes, people of Asian or Black descent, and patients who smoke. There are two types of statin intolerance, partial and complete. Partial intolerance is the ability to tolerate the statin at a lower dose to achieve this desired therapeutic objective. On the other hand, complete intolerance is the inability to tolerate any statin at any dose. There is clinical evidence that shows that statin intolerance is a nocebo effect, which means if you have a negative expectation of the statin, it can cause the treatment to have a more negative effect than it otherwise would. While this does not apply to everyone, it doesn't make it any less relevant, as there are real apparent side effects which your doctor should address. What should you do if you are experiencing statin intolerance? Ask your doctor if they can lower your statin dose, switch it to a different statin, or if you can do a non-daily dosing schedule. Again, talk to your healthcare provider before discontinuing the medication. Poor adherence to statin therapy has been linked with higher risk of heart-related outcomes such as heart attack or stroke. Alright, I know that was a lot of information, so let's wrap this up. If you are having any issues with your statin, please be sure to talk to your doctor or pharmacist. Also, keep in mind that Marley Drug can save you up to 95% on your medications compared to your local pharmacy. Thanks for chiming in, guys. Bye for now.